I'm an assistant practitioner and I work for the infection prevention and control team. We're a very busy team. We work a lot out on the wards. We do a lot of we give a lot of advice and guidance and training out for different clinical areas and departments. So my role was developed back in 2009 when the infection control service in the hospital needed to expand, but they didn't actually need a registered nurse to fill the position. So initially it was a part-time role, 22.5 hours working as a support worker, and then in October 2009 it became full-time. So it was developed really as part of a need to expand the team. We have 3 infection prevention and control nurses plus myself, and we also have a PA to the microbiologists in the lab as well. I really enjoy my role. It's really interesting. I get to visit all the different wards and clinical areas and get involved in lots of different things in the hospital. So it could do a lot of auditing, visiting different areas. We do some environmental sampling. It's a very varied role. We do a lot of training with the staff. We have a lot. We're obviously here for advice and guidance as well. So it's a really interesting, really varied role, and yeah, it's really interesting to work for the team.
I'm an assistant practitioner in the Norwich locality, Norfolk County Council Community Care Team. Yeah, we do face-to-face assessments in the community once we've received a referral from our customer service centre, and they tend to be more complex cases that can't be dealt with over the telephone. So we would go out and do an assessment of somebody's social care needs. They may not have been known to social services before and require a completely new assessment, or it may be a review of services, or it may be they've got a change of circumstances, which means the services they've got at present are not meeting their needs. Recently it's changed that we're doing scheduling, which means that social workers are going out and doing very complex assessments, and then they're asking assistant practitioners to do support planning with the individuals to help them to use their personal budget to meet their needs in an appropriate way. I think I like the fact that you don't really know what's going to happen every day. Every day is very different. We get to meet some really interesting people, lots of different people, lots of other professionals, not just people who use our services, and the spontaneity of it as well I personally enjoy.
My role as an assistant practitioner in the team is supporting the exercise instructor and the cardiac nurses with exercise assessments, exercise groups, and home visits to see patients who can't come in. And the whole idea is basically after their event is trying to get their fitness back, get them a bit stronger to help prolong another event occurring really for that patient. The favourite part of my role I like is working with the patients within the group, getting their fitness back up, monitoring how they're doing, how they progress over the weeks. Exercise assessments are quite interesting to just see where they are at the beginning to when they finish. A lot of patients do improve with our input through service. Another part is working within the clinic, so when you see the patients when they first come out of hospital, assessing how they're doing, talking about their lifestyle, helping them to change things for the better to help prolong something else happening in the future really for them. There has been a few challenges because this is quite a new thing that I've worked in for cardiac rehab. Because it's so specialised, it's having an understanding of what bypasses and valves, what surgery was. Luckily I managed to go and watch some operations at Patworth to have a better understanding, so then at least I know what I'm dealing with when I see the patient either in clinic or the exercise group. I know what they've been through. Just being able to take on more responsibility, being able to prove myself over the years of what I've learned to how I can give back to the team and to the patients.
My name is Charles McCluskey and I work for the Ipswich Hospital, NHS, and my role is as an assistant practitioner. As an AP, I cover quite a lot of the duties that are required of a member of staff in the theatre environment. I'm responsible for collecting patients for the procedures, circulating in the theatre for the scrub nurse, and I'm also responsible for scrubbing up to provide instrumentation for the surgeons during a procedure. My role as an assistant practitioner brings quite a wide range of benefits to the patient due to the fact that I think I can step into each role quite easily, and the more contact you have with the patient, the more relaxed they are, and the easier the procedure turns out to be. The stay in the hospital becomes more of a pleasant experience, and they don't mind if they have to come back again. Or as they leave the unit, it's a cheery on, take care sort of thing. So I think that patient contact is important, and the more that patient can get to know the person looking after them, the more relaxed they feel, the happier they are, and the easier the whole system runs.